Oh, God. Hey everybody, it's Dr. Galvin. Just wanted to give everybody an update from the ER. It's my first shift back in about 2 weeks. If anybody watched my video from last week, I had a breakthrough case of COVID that I think I got from my daughter. I had very, very mild symptoms. I had basically the sniffles for about a day, but I had a quarantine for 10 days. So all last week I saw patients at that clinic by telehealth, and I actually missed a couple ER shifts, but I did work last night. It's the first time in a couple weeks that I've been back in the ER, and it's a zoo. The situation in North Carolina and throughout much of the South is just really, really bad. Volumes are crazy. In our place right now, the wait times are 15, 16 hours. I actually took care of one lady last night who'd been waiting for 18 hours. She'd gotten to the hospital at 7 in the morning yesterday, and I took care of her, in the middle of the night sometime. It's just crazy. We're seeing an absolute ton of COVID. Many of them are sick and young, and a lot of people have asked me sort of the breakdown, and so I actually was looking at the board as we went through, and basically, and I'm sure I missed some because the PAs are seeing people out in triage, but by my count, we had 28 unimmunized COVID patients, 5 that were in the hospital immunized, and 4 that had COVID previously with COVID again. So 28 unimmunized cases, 5 breakthrough cases in immunized people, and 4 breakthrough cases in people that had it before. Of the 28 unimmunized, 18 of them were admitted to this hospital. 2 were transferred out. Now the 2 we transferred out, one was 13 years old and one was 11 years old. And were both transferred to the Children's Hospital, and 8 were sent home, so that's 28. Of the immunized people, 2 were sent home, 3 were admitted. The 3 that were admitted were all above age 75. And of the people that had COVID previously, 2 were admitted, 2 were discharged, and both of the admitted people were maybe over 60. The age range of the admitted unimmunized patients was between 35 and 65. So the most of those unimmunized people are relatively young, and I think I've talked about that before. That 95% of the patients we're seeing in our system are less than 65 years old, and 10% are less than 18. As much as we've had these debates about kids in school and masks, and it's a big fight, we've had over 200,000 kids have caught COVID just in the last week. So we've really got to look at that. And if you look in the, I tell you, Google like COVID outbreak schools, there's been 40 or 50 outbreaks in schools since the school started, a week or 2 ago, all over the country, where schools have had to shut down or they've had to, lock down in some way or another. So kids are definitely giving it to each other, and they're also giving it to others. And I think interesting was the MMWR report, which is the mortality and morbidity weekly report that's put out by the CDC. And there's a case report there of a teacher in California, and I think she was an elementary school teacher, had 24, 28 kids in her class, and basically went to school sick for 2 days, had symptoms of COVID for 2 days, but went to school anyway. That school, they masked the kids, and they also had the kids all separated by, I think all the desks were 3 feet apart. But this teacher who was infected with COVID was up in front of the class and was reading to them, and when she would read, she took off her mask. And it turns out that she infected the vast majority of those kids. And very interestingly, there's a chart in that paper that shows the kids that were close by in the first couple rows got infected and had symptoms. And then as you sort of went back farther, there were kids that had positive tests that didn't have any symptoms. And then towards the back of the room, there were kids that had negative tests. So you can sort of see that proximity played a role. But, I don't know what that teacher was thinking, going to school sick and being unimmunized, being at high risk. But anyway, we've got to look out for those things. I'm rambling a little bit. I'm going to cut it off here. Tonight, I am going to be debating with Dr. Dan Stock of the Indian School Board viral video fame on the mouthwash talk show on YouTube. It's at 9 o'clock tonight. So tune in for that. I'm pretty sure I'm going to be on it. There's been a little bit of controversy. Dr. Stock wants to talk about how he thinks that the virus was engineered as a bioweapon. I don't have any knowledge of bioweapon design. I don't think that that's an appropriate topic to cover. I think we should talk about masks in schools and vaccines and the other things that he made claims about in his video. So I may or may not be participating at least in that particular part of it, because I don't know anything about bioweapons, and I don't feel like my opinion means anything about them. Anyway, but tune in for that tonight. It's Tuesday night at 9 o'clock on YouTube, the Mouthwash Show. I'm Dr. Jeffrey Galvin. I'm board certified in emergency medicine. I've been posting updates since this began. If you like us, please follow us on Facebook or subscribe on YouTube. I'll be back with more later. See ya.